The Primary Care Partnership Platform was established in 2000 to support the building of place-based partnerships between local government, health and community support service providers. We have worked together for over 20 years to maximise health and wellbeing outcomes and promote health equity. The Bendigo Loddon PCP draws partners from the City of Greater Bendigo and the Loddon Shire. The first 10 years of the PCP platform work was focused in the areas of service coordination, integrated health promotion, and integrated chronic disease management. The focus on system change has remained with a stronger concentration on addressing the social determinants of health and the primary prevention of ill health. Over recent years, the work has centred around healthy eating and active living, family violence and gender equity, mental health, vulnerable children and families, and health literacy. The overriding purpose is the collaboration to implement prevention and access and equity strategies to support good health in our rural and regional communities. Partner organisations have a long and strong contribution record across the catchment. Trusted relationships have been built and extended to partnerships with neighbouring PCP colleagues within and beyond the Loddon Mallee region. In 2021, the Bendigo Loddon PCP consists of 28 partner organisations supported by a small staff team. Currently, the board members represent 11 partner organisations across local government, community services and health services, bringing together key organisations to support system change and collaborative action for better health outcomes. The result of the health reform and government changes will result in the transition of the PCP staff into the local public health units in April 2022. We anticipate the continuation of our strong cross-sectoral working relationships in the next stage of working together with a place-based focus into the future. Dan Douglas has been the chairperson of Bendigo Loddon PCP since 2017 and has contributed at different times through the role as Loddon Mallee Region PCP Chair and is currently the Rural PCP Chair's representative on the statewide PCP Transition Reference Group.
Hi everyone, my name's Dan Douglas. I'm the CEO of Heathcote Health, but I'm also a board member of the Bendigo Loddon Primary Care Partnership, and for the last little while I've been the chair of the Bendigo Loddon Primary Care Partnership.
Bendigo Community Health Services have been the auspice organisation of the Bendigo Loddon PCP since its inception in 2000. As well as contributing as a partner in the collaborative work, Gerard and his team have supported the ongoing work of the Bendigo Loddon PCP management and staff.
Hi everyone, Gerard Jose here. Celebrating our Bendigo Loddon Primary Care Partnership and a final board meeting for 2021, I thought I'd say that I've been privileged to be involved with PCPs in different areas and over an extensive period of time. The Northern Mallee Community Partnership up in the Sunraysia, Campaspe, and in joining Bendigo Community Health Services nearly 3 years ago. It was wonderful to have a partnership with the inspiring staff at Bendigo Loddon Primary Care Partnership as the auspice organisation, and to enjoy joining the board and collaborating with others around the region.
In her voluntary role as independent chair of the Bendigo Loddon PCP Finance Committee since 2013, Jude has supported the financial literacy of the organisation, as well as bringing an important local government understanding of the value of the work achieved in the partnership for rural communities.
Hi everyone, my name is Jude Holt and I'm the current chair of the Bendigo Loddon PCP Finance Committee. And over the past few years, I've had the pleasure of working along with the committee, who have changed in cohort, but nevertheless have not changed in the passion that they have had to manage the finances of the Bendigo Loddon PCP in a way that we could leverage every opportunity possible to deliver programs and projects for positive health outcomes for our communities.
Please describe your experiences of working in the Bendigo Loddon Primary Care Partnership and what this has meant for your organisation and your work in prevention and health equity.
So being a member of the Bendigo Loddon Primary Care Partnership has been a very valuable opportunity for Heathcote Health and myself to grow and develop. It's certainly, there's a lot to be learned through engagement with a number of other key people involved in prevention across the Bendigo Loddon area, and I've formed some really valuable friendships and relationships with other board members, but also with associate members, and certainly with the executive officer and the staff of the Bendigo Loddon Primary Care Partnership. It's a very important role in looking after the health of people in this area, and there's been a lot of really fantastic initiatives and projects that have been led either with or through the partnership, and that's been very important for us.
Hi, Wendy Gladman, Loddon Shire Council. When I think back to what the PCP has meant for our organisation and our community, I think back to the early days of when we were establishing our partnerships, and we started to look at an all agencies approach to improve the health and wellbeing in Loddon Shire Council. The PCP was instrumental in bringing everyone together, in establishing the partnerships and guiding us to make sure that we worked from the same platform and that we all had the shared common outcomes we wanted to achieve.
Hi, my name's Mandy and I'm the CEO at Northern District Community Health, and I wanted to tell you a little bit about our experiences being part of the Bendigo Loddon Primary Care Partnership. They've been very positive, and I suppose the highlight for me has been the impact it's had on our community across the Loddon Gannawarra network, with the PCP leading work around a health needs analysis for our communities, and then developing an action plan that we've been able to implement with funding that they supported us to apply for as well. And this has led, I feel, to our area having better health equity and addressing some of the health inequities that we have across our community. And without the support from the PCP, I don't think this work would have happened. So I'm forever grateful for the team at the PCP for supporting us through this time and for getting us to a point where we're actually able to do something about it. So it's been extraordinarily great work.
Tell us about your experience as a board member leading this partnership.
I think with most partnerships, it's all about relationships, and it's about understanding each other and making sure that we work together well. And I think that's achieved through the Bendigo Loddon Primary Care Partnership. It's a very collegiate atmosphere on the board. We certainly all have the very best intentions to get outcomes for our community, and I think that's what keeps everyone working cohesively and collaboratively. So it's been a very good process, and I'd highly recommend, if you're involved in partnership works, to look at the model that's evolved through the Bendigo Loddon Partnership.
My experience as a board member in the partnership has been one of learning. It's of being really proud of the great work that this PCP has achieved, and of sharing the fellowship of our partner agencies and coming together to work to achieve better outcomes for our communities.
only been a board member for the last couple of years, and for me it's been about getting great support from colleagues across the sector, including other health services and local government and the DAC, and getting to know those amazing leaders across the organisations and feeling part of a team, and feeling supported and being able to reach out and have conversations with people when needed. So for advice or guidance, or when there's a gap or a problem, it's been really great to have those relationships and to have that respect across the leaders of health and local government in the area. And I've also found it very inspiring. Often I would go to a meeting and Eileen's organised a guest speaker who's amazing, and I come back to my team with fantastic knowledge and tools about how to support our team to be even better at what they do. So for that, I'm forever grateful.
What have you valued about the work of the Bendigo Loddon PCP and the outcomes for our communities?
Over the 5 months that I've been at Bendigo Loddon Primary Care Partnerships, I've really got a sense of the value that's come from the years of partners learning together and collaborating. And when organisations can share values and share understandings, I think it has a huge impact on the health of communities.
Firstly, I would like to say it has been amazing to be a part of the PCP team over the last 3 years. The unique role in facilitating partnerships and collaborative place-based actions is something to be admired. For me, working alongside the leaders in health and community organisations in the Loddon Shire and City of Greater Bendigo has opened my eyes to the importance of partnership and sharing of resources. It's been great to be a part of and facilitate healthy eating, active living and smoking prevention working groups, as well as being heavily involved in mental health networks. My involvement in board meetings at BLPCP has also been a highlight. Watching our leaders of community and health services within the area think strategically and collaboratively for the better health outcomes for our community. Our position as the PCP has allowed us to support and also coordinate specialised projects in conjunction with our local government agencies. For me specifically, it's the Oral Health Literacy Project and the Rural Women's Health Needs Report. The multifaceted role of the PCP has been great to be a part of, and I really look forward to continuing some of this work as we transition into the future.
Reflecting on the work our staff team has done within the partnership, what's been unique, I think, is our capacity to help facilitate partnership initiatives that address things like service access in rural communities, or making it easier for people to navigate the service system across different health, specialist community or government sectors. What helps us to facilitate some of these things across partners is that our job is to support the partnership. So we don't have any particular organisational agenda as such. This really helps to build trust, I think, which is the prerequisite for any partnership work. And it's quite a privileged position to be in.
My reflection is it's all about people. It's about people working together, working cross-sectorally and across communities, bringing understanding and insights into the opportunities and barriers for system improvements, for better outcomes for individuals, families and communities. It's about the people in the partnership, the building of relationships and the contributions made, knowing who can and is committed to influence parts of the system, drawing on individual and organisational strengths with an understanding of what makes it better. It's about respect and collaboration, joining together to aim for common goals and valuing the achievements in the journey. listening to the people and the communities who are affected by the system about what works and what doesn't. Working with communities and responding in place to place-based needs. Respecting and understanding commonalities and the differences in rural and regional communities. It's about people working as a team, allowing each person's strengths to contribute to the shared goals and the understandings of how to engage others to achieve them. My fortunate experience is working with two complementary teams, the partnership team and the staff team. It's been my privilege to be part of these teams for the past 8+ years as the Bendigo Loddon PCP Executive Officer, and previously as board member with Central Vic PCP for over 10 years prior to that. It's about the deep understanding of where health is created and ill health is prevented, where health is managed and enhanced in our communities, and the connections between that impact on people. It's all about the people.
The recent process where we've had to look at the high value functions of the primary care partnerships in general, and specifically ourselves with Bendigo Loddon, it's certainly highlighted the breadth and depth of work that's done and the enormous contribution the partnerships made for local people here. And I think we've only really, it's the tip of the iceberg of what we've actually uncovered compared to what has actually been done. PCPs have been in place for over 20 years and they've been a highly valued and productive and effective way of undertaking prevention work and health promotion work locally.
But my first interaction with the PCP came in 2007 when I was Director of Corporate Services of the Loddon Shire Council. And for many years I sat around the boardroom table with representatives from the other health services and local governments within the region. And the one constant that I can say has been in the boardroom and in the committee room every single time, week in, week out, is the passion that everyone has for positive health outcomes for our communities. We've been ably led by Eileen Brownless for a very long time now, and she has built an amazing team. And together they have delivered on a shoestring. And in one way, I think it's really sad that we won't be continuing under the current umbrella, but I have every faith that Eileen and her team will take the passion that they have for the community and for positive health outcomes into the new structure. So even though it might be farewell for me, for my role, it's certainly not the end of an era for the work that Eileen and her team do. So congratulations, everyone. There have been lots of people over many years who have been involved in the Bendigo Loddon PCP, and it's been a really successful partnership. And no doubt everyone will continue with the passion that they have under the new umbrella.
I would just like to say how much we appreciate the work of the PCP for Loddon Shire, and certainly that work that really has set the foundation for us for many years to come. Thank you, PCP.
I think for me, Eileen Brownless is an amazing leader, and I'm looking forward to how she's going to support the next iteration in the public health units to support us to continue on our health equity journey, and I can't wait to see what happens. And thank you all at the team so much for your support and guidance and energy and skill. We really have appreciated it across the community. Thanks.
I feel a little bit sad to be speaking of change, and that's why I'm wearing the black hat. So this afternoon, as a very poor bush poet, I thought I would share my thoughts as verse. Here we go, now please, I can hear you laughing. Ode to Bendigo Loddon PCP community. In community lies strength in partners, to support our sick and the weak. In PCP community, we support charters with shared data and voices we speak. In PCP community lies public planning to address the inequities of life, to offer and receive common friendship, to protect others from chaos and strife. In PCP community, we teach each other about the science of disruptive thought. From this we gain our vitality and richer thinking is sought. In PCP community, others surround us with stories from the bush that encourage hearts to connect and minds to be open and fresh. In PCP community, reform may come. A collaboration is faith to us all. The transition call lingers less strongly, as upon network members we call. In PCP community lies our ambition. Without makes larger the gaps. So together we create a sense of well-being and bring closure with some tears and some claps. Thank you, Bendigo Loddon Primary Care Partnership.